It's one of the most telltale ways to monitor fetal health, tracking their heart rate from the moment their tiny heart beats.
Tells you like from outside how is the fetus doing.
Doctors use Doppler ultrasound technology to monitor a fetus's heart rate at a clinic. Well, now there could be an app for that using a smartphone.
We place the phone on the belly of the pregnant person, facing the microphone, facing the like the abdomen, and then we start our app.
Pujita Garg is a PhD student at the University of Washington School of Computer Science and Engineering. She and a team of researchers are developing the app that she calls DopPhone. Because mobile phone mics are not nearly sensitive enough to capture the subtle frequencies of a fetal heartbeat, Garg and her team found a way to mimic ultrasound using machine learning to analyze the recorded audio combined with patient information.
We use off-the-shelf smartphones and use its speaker and microphone to act like a transmitter.
So, what about reliability? In a clinical study with 23 pregnant women in their second and third trimesters, Garg's app estimated fetal heart rate with an average error of 2 beats per minute, or BPM. The clinically accepted range is within 8 BPM. Basically, pretty accurate.
We tested on different patients, different BMI, different age group.
Garg says the technology is still in early stages. Patients will not find this in the App Store anytime soon. The next steps include broader out-of-clinic testing with more participants to improve the AI before any public rollout. For now, Garg's inspiration for this app endures, which is to close the gap in healthcare disparities. For women in rural or low-resource areas, getting to an ultrasound, let alone reserve time for it, is not always easy.
There are a lot of maternity care deserts, marked areas or marked counties that have very low access to these obstetric care. So people have to travel, or the expected mother has to travel long distances to reach the first nearest hospital.
Garg also understands the caveats to at-home monitoring and envisions the app being used in partnership with the patient's doctor, not as a replacement for medical care. The app would be designed to send the heart rate data to a physician so that the patient and medical professional could analyze the data together. Garg's findings were published in the journal The Proceedings of the ACM on Interactive, Mobile, Wearable, and Ubiquitous Technologies. For HealthLink, I'm Christine Pei.